today I want to talk about the front pelvic pain. Okay, so some of you may be experiencing this if you're pregnant, or you may have experienced this when you were pregnant, where that front joint right on your pubic bone there feels like it's out of whack, and there's some sharp pain that goes on with it, often with spreading your legs apart or putting all your weight on one leg. Those are often challenging, and it's called symphysis pubic dysfunction is usually what it gets called, but it's basically just this front joint here on the pelvis. If you look at the pelvis, this is the top, spine at the back, and then you've got these two big bones. This is sort of like all one bone, and then there's one in the back. So 3 bones in the pelvis, but there's this major joint at the front, and it's usually quite stable. But, you know, if you're going to deliver a baby, you need all these joints to lax a little bit so the baby can come out more easily. So sometimes people have issues with this. It's not only pregnant women who have issues with this. This shows up in other places as well. And so there's the difficulty of, like, how do I live with this while I'm pregnant? Sometimes it starts quite early. And also, if it doesn't resolve afterwards, often it does for people, but if it doesn't, what's going on? Like, how do I get to the root cause of this? And there's a lot of advice out there on how to sort of live with it, not to aggravate it too much, which a lot of it's like, keep the legs together as much as you can when you're getting out of the car or rolling over in bed, to go upstairs sideways, things like this, which can be super helpful, but they're not actually getting to what's causing it. And so when you're pregnant, sometimes it can just be that laxity that's causing it, but it can also be an imbalance of muscles, okay? So first up, if you're pregnant and experiencing this, and even postpartum and experiencing this, or just a random person experiencing this, go and ask around in your local area and see if you can find someone, a practitioner, a hands-on practitioner who has a proven track record with this front pubic joint pain, with relieving that, because there are some practitioners who can really give you a bit of a reset, and that pain can go away or reduce significantly, which makes it way easier to live with until it can resolve and you can get to the root of it. Okay, so definitely ask around. Not everyone is going to be awesome at this, but some people in your community probably are. So find them, ask all your friends, ask the receptionists at the front desks of those places, because they do exist, and get that help. You don't need to live with that much pain. Okay, so but what is happening here? Okay, you've got this front joint. It's a little unstable. I don't know, unstable. It's just, there's a lot of discomfort here. It doesn't feel good. And in my experience, I never had this front pelvis issue. But after my son was born, I had a lot with these 2 joints in the back. And when it felt like things were out, I got major, big, like neon flashing signs saying, danger, 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 right? My nervous system just went whoosh, right out through the roof. It was like, oh my God, we're in big trouble. And it makes some sense, because the pelvis is like the support for your spine, right? It's this transition point between your legs and your upper body. And so if that support isn't there, it can be really upsetting. So I understand that this kind of pain can be, it can feel enormous, okay? But in my experience, there's some help for it, okay? So muscles can impact how a joint is working. And if we look at this joint here, there's 2 main areas that I would look at. First up is the inner thigh muscles. They're called the adductors. So like adding something, ADD, adductors, and it's a group of muscles on each side. And so there's, on one side you have them, and it attaches all the way along this ridge. These are your sit bones, by the way. The scientific name is ischial tuberosity, but they attach all right up in close to this joint and all the way down along the sit bone, on both sides. So one leg here and the other leg here. So first up, we need to look at those inner thighs, because can you see how if one side is really tight, that it could just like a slight pull on that joint, a tension in that joint that could be uncomfortable. It could give you that feeling of like, oh, it doesn't feel good. Okay, so you need to look at those muscles. Is one side super tight? The other thing you need to look at is, are they both firing when you go to use them, right? So does one side fire and the other one doesn't? Because that's a problem around this joint. You're getting a lot of repeated pull on one side and not really anything from the other side. You see how that could be an issue? Okay, the other spot I would look is right above. Here we go. Right here is low abs, low transverse abdominis, which is more the corset style one. And your lower internal obliques also sort of run across like this. And so you can see how that actually would give quite a bit of support at the top of this joint as well. And it's not such a long lever arm like these. It's more likely your inner thighs, just because they're pulling, like it's their longer muscles, right? These ones travel this way, these ones travel this way. It's just easier to pull down than it is to the cinching across, but it's worth looking here too. You want to look, do your low abs even fire? Because they might really not be doing a lot of responsiveness. Your upper abs might be way stronger. And then you also want to look like side to side. So there's a piece of connective tissue that runs from your pubic bone up across your belly button and then up to here, so like this way on your body. And it's not a muscle, it's like connective tissue. All your other ab muscles actually attach into it, right, from each side. And so it is possible too to have more action going on one side of your abs than on the other. Okay, you might have one side that's tight or not firing very well, or vice versa. Okay, so these are the two main areas I would look when you're dealing with pain, this intense pain in the front of your pelvis, and wondering what to do about it other than just try not to aggravate it. Because while those are good, it's nice to actually feel like you're getting to the root of this. So I think I'm going to actually make a video to walk you through how to do that and post it in a few days or next week or something like that. So stay tuned for that because it seems like there's a need for this, and this is something that you guys are really struggling with. And that's enough for now. Bye.